Hi everyone, I am Dr. Ujwal Gajula, consultant medical gastroenterologist and hepatologist, currently working at Prathima Hospital, Kukatpalli. Today I am going to discuss with you about a disorder what we call it as Irritable Bowel Syndrome. Commonly like IBS is a common GI disorder which usually affects around 10% of adult population in India. This is not a life-threatening problem, but it affects psychologically in most of the patients with IBS. So, what are the symptoms we usually encounter in patients with IBS? See, in IBS, most commonly they present with abdominal pain, which is of crampy in nature, mostly happens in the lower abdomen. Along with this pain, patient can have severe diarrhea, that means increased motions like loose stools in some patients. Some patients may present with constipation also. Along with these three symptoms, some people may have bloating, abdominal distension, and feeling of heaviness after taking food, and sometimes they may have stools which are mucus in nature. What are the tests? What are the things which we need to do when we are thinking of IBS? So, actually, IBS is a disorder which is related to gut increased hypersensitivity, which is mostly happening due to stress and anxiety. And sometimes there are some food products that can trigger IBS, such as wheat products and taking milk products, and some of them will have some triggers with while taking high FODMAP diet. FODMAP means they have high fructose and oligosaccharides rich foods. If somebody takes all these things, they can develop IBS. So how we can diagnose IBS? First thing is, if you have symptoms of IBS, meet a local gastroenterologist and evaluate for any other major diseases or related to large intestine to make sure that you have an IBS. IBS is the diagnosis of exclusion. If you find any stress and anxiety and having frequent motion or constipation along with pain, and go to gastroenterologist and check your colon to make sure that you don't have any colon related problems before diagnosing IBS. So what are the treatment of IBS? Mainly, IBS treatment involves controlling of stress and anxiety, so that stress can also aggravate increased bowel movement or also constipation. So first major thing is controlling of anxiety. Second thing is, there are some food changes which you need to do in IBS, such as avoiding high FODMAP rich foods, avoiding milk products and wheat products. And third thing, there are few medications to reduce IBS, such as anti-anxiety medicines, and along with that thing, antispasmodic means to reduce the pain, abdominal pain. If somebody develops diarrhea, we give antidiarrheal treatment temporarily, and if somebody develops constipation, we give laxatives to reduce this constipation. Along with this thing, there are role of probiotics. These are nothing but a healthy bacteria which we usually give in the form of capsule form, and at the same time rifaximin is an antibiotic which usually give in patients with IBS to treat any infection in the gut. And at the same time, some people can have benefit with yoga, meditation, and some kind of anxiety relief measures which can help in alleviating IBS. So friends, if you have IBS, go to gastroenterologist, take care of your gut. Thank you.